The effective response to disease outbreak globally has historically been very challenging. With a vision to transform the health sector in Delta State and turn into the pace-setter in the Nigerian Federation, Governor Okowa has since May 29, 2015 continued to ensure the health system in the state is strong enough to withstand any outbreak of infectious diseases and bring them under control.
His Excellency the Governor has adopted an approach that I don't think any other states, has. This is in recognition of the fact that he is a medical doctor and one who understands the dynamics of the public health crisis that we are faced with. Now, the situation requires desperate measures. It requires critical decision.
Delta State government have done so well. I've seen a lot of quality things. It shows that there is government presence in the state. To narrow it down to the State Ministry of Health, I've been hearing the fact that there is kind of executive secretaries that are doctors in each of the health DAs that are mounting the primary health center and mounting the local government. That is a welcoming development in the change of health sector.
In the recent past, the Delta State government's preparedness, strategies and eventual response efforts have continued to address diseases like malaria, typhoid, yellow fever, tuberculosis, polio, COVID-19, and HIV and AIDS, to mention a few.
His Excellency the Governor, Senator Dr. Okowa, has done a lot to support disease control in general and even elimination of certain diseases. So we do a lot of routine work to prevent outbreaks rather than having those diseases occurring in children and even in adults. Even in non-communicable diseases, there's a lot being done to ensure that the rate of disease occurrence is reduced significantly.
Over the past 2 decades, HIV and AIDS, which is one of the world's most serious health and development challenges, remains a leading cause of death. Governor Okowa, in his own corner of the world, has accelerated efforts to end the HIV pandemic by planning and implementing HIV prevention, treatment, and sensitization programs.
There was a time in this country, all the state action committees are transited to agencies except Delta State. It was that embarrassing during his predecessor's time. So when Dr. Okowa came on board, he sent a bill to the House of Assembly, and within 3 months, the State Action Committee on AIDS transited to state agency. The governor had appropriated 100 million naira for that drive. That's why you could see that from when he came, we had enrolled like 20,000 persons living with HIV and started receiving treatment. But as at today, we are almost at 70,000. So that money went a long way for we to move from the health facilities to the community to look for these persons.
HIV is not even as dangerous as some diseases that we know. Since HIV can be controlled and can be managed effectively, nobody should think that it's a death sentence. We have supportive team that will help you manage and live positively and live for long.
In 2020, the Delta State government launched an HIV/AIDS self-test program to promote effective testing for the viral disease amongst residents of the state. This, in no small measure, has reduced stigmatization and ensured the availability of testing kits to hard-to-reach clients.
We are presenting these HIV self-testing kits to the members of the Delta State Executive Council for use by themselves, family members, as may be needed. It is extremely convenient. It's affordable. It's going to be very, very available. It's going to be like a condom. I'm not sure you will be shy buying it. So this guarantees strict confidentiality. It's known to only you. It's self-applied. It does not give pain. You don't need to prick anybody. You don't need to take any blood. All it does, you just read your gingival exudate from your mouth, obey the necessary protocols, and in 20 minutes, you are getting a result.
In a summary, HIV self-testing is all about you doing the test to yourself.
Even for people that are HIV positive, once they start taking the drug, they become non-detectable. And at that non-detectable values, we are very, very, very sure that the HIV transmission will not go on.
Understanding the stakes involved in fighting these endemic diseases, Governor Okowa, for almost 7 years, has ensured necessary resources are allocated and on time through the instrumentality of the Ministry of Health, supporting agencies and implementing partners.
Just a year and a half ago, about January 9th, 2020, we had about 22,700 persons on treatment. And we were classified as an HIV scourge state. They got to his attention of His Excellency. He summoned us. He empowered us to go and search for Deltans anywhere they have HIV and make sure they are placed on treatment. I can tell you as I speak now, over 66,000 Deltans are on treatment. And those 66,000 Deltans are not only on treatment, they are virally suppressed. So they are not in position to transmit the virus to any person in any form. That will tell you the amount of support the government has given. He made sure that we had enough consumables and we are carrying out tests massively in all communities as much as we can.
I am one of the present governor's biggest fans. You need to go on Twitter and see the pronouncements that His Excellency made. And he's not one of those governors that makes the pronouncements and walk away. No, he made a commitment of 100 million naira to the HIV fight in Delta State, and that money was released, the test kits were bought, and he's always been a supporter of the HIV program in Delta State.
All forces such as NEP1, NACA, and SACA have all joined hands together to pull their weight in gold as they fight for the elimination of related associated morbidity and mortality, HIV-related disparities, and health iniquities. These people living with HIV and AIDS, PL-HIV, also have full access to their life-saving antiretroviral drugs with the significant assistance of Caritas Nigeria as a major donor.
Caritas is an agency of the Catholic Church that does humanitarian and development interventions in Nigeria. We work in the HIV space, health. So in January 2020, the governor launched Surge Intervention in Delta State, which helped to accelerate case finding for those that are HIV infected. And that he made a pledge of some funding, which working with us as the partners and SACA, we're able to aggressively scale up coverage of ART for people that are infected with HIV in the state.
And I'm here to strengthen what a Delta State government is doing and what implementing partners are also doing. So we are working together to ensure that the end result will reduce HIV transmission to the lowest level.
Watch Smart Delta team unravel this story.
It's 6 a.m. and we're on our usual routine visits to different parts of Delta State, this time to healthcare facilities. This is to bring you up to speed on the progress made so far in the healthcare sector under the leadership of Senator Dr. Okowa. My name is Henrietta Nwara. Stay with us. Our first port of call is Central Hospital, Sapele. We're here to speak with clients living with HIV and AIDS to hear firsthand their experiences. Join us.
Understanding that maintaining confidentiality is an integral component of medical practice, we had our resource persons living with HIV and AIDS speak with us against our camcorder. At the Heart to Heart Clinic, Central Hospital, Sapele, we met two clients. One is a grandmother at the age of 58, and the other is a 38-year-old young woman with two children. They appreciated the love the medical practitioners showed to them. Take a listen.
No total cure for AIDS, but we have very good management care. As long as the person they take a treatment, keeping to time, because the drugs actually work with time. So it's just like every other sickness. It's not a death sentence. The fact that you have been pronounced HIV positive does not mean you will die today or tomorrow. You live your normal life, you do your normal job, you give birth to your normal children. And my children, by the grace of God, they are free. My husband is negative, and my viral load level now is showing not detected. Means I cannot even transmit to people around me. My children are safe.
Drugs are very free. They're available to everybody. The donors, they are trying.
As we surged through to our next stop to bring you more stories, the rays of the sun, embroidered green gloom, slowly glittered through the communities of Ughelli as we arrived at the General Hospital. Upon arrival, we were ushered in by the Chief Nursing Officer, Mrs. Brickins Gladys. She took us to her office where she counsels these patients.
The blood they collected, the particles of the virus were not found there. It's not that we are cured of the virus, because this drug doesn't cure the virus, but it can wipe the virus from your bloodstream. So the more faithfully you take this drug, the more you continue to be not detected. And when you are not detected continuously like that, everybody around you will be free from contacting the virus from you.
I'm taking my drugs regularly. I'm living a healthy life. I'm okay. I have children. I'm married. Actually, when I find out, it was when I was about to get married. So after I discovered, we still went ahead to get married. So I was cancer. When I started, I thought life has gone out of me. But with the help of especially the matron, who is always seeing us, Matron Brickis, she was the one counseling me, talking to me about taking my medication. When you look at other ailments that kill people, but look at me, I'm still alive, and I know I still have many more years to live, so I'm very happy.
The very day they diagnosed me of HIV positive, in fact that day was not an easy thing, but ever since, Metro cancelled me, and I've been on my drug, taking my treatment. I feel relaxing, and I feel happy whenever I come to clinic like this. She keep on encouraging me that take this drug. When you take this drug, you'll be okay. I'm even with 5 kids. They are all negative. Since I'm on drug, my viral load is not detected. If I check my weight, I'm weighing almost 80 now. So I'm okay. I don't really have any problem. All my children, they are all negative. You see, they are looking healthy. The drugs are free. Even the test we go for, everything is free.
Dr. Governor Okowa, he is doing well when I was pregnant, and I'm glad I was actually detected at that particular time. What I keep telling people is that it is better they detect you early. You start your drugs. What is difficult in it? Just take them and you remain healthy. Your viral load suppression is done, and everybody around you are safe. What more can you ask for? What other miracle are you actually looking for here?
We met a widow who narrated how it all started and how helpful the antiretroviral drug therapy has been to her.
God will bless them, because it has not been easy. They tried. Sometimes, even though we don't even have transport to come, their staff will still carry the drugs to come and meet us at home. They know our houses.
So the good news is that HIV is not a death sentence.
Our trip was cut short by a heavy downpour, so we continued the next day.
Smart Delta.
The same testimonies resonate with patients at the Central Hospital, Abo.
When I contact the sickness, I start sick every day. I started taking these drugs. I've never been sick. The doctor told me to be taking it once in a day. They have done well to bring the drugs, and I thank God that whosoever they bring these drugs, God will surely bless him or her.
Over 10,000 people have actually enrolled into this ART program, and currently we are having over 4,000 still on treatment, though we know that some people must have died because of one reason or the other. But frankly speaking, this project which was initiated by the commissioner, then now the governor of the state, has saved a lot of millions of lives in that state, and so I think it's a welcome development.
No. What do you talk? Ask me that question again.
I say the way Governor Okowa take the work, it not be like saying next year 9-10 or the over.
Why you talk so?
The full force when he take the work, when he enter power 2015. Now so he still the work, even till this 2022 where we did so.
That reminds me, yesterday, as I dey come back from Frayo place, now say Governor Okowa don dey do road for the whole Umuagu. As Umuagu open reach, Governor Okowa dey do road everywhere. The thing shock me. Na so I put hand for waist begin dey look, say, even come reach now, Governor Okowa still dey work like this.
No wonder they be talk say Governor Okowa came prepared.
Yes, so very, very prepared. You know, say around 2020, when yellow fever hit Delta State, say this Okowa government was able to control the infectious disease and they managed it to a barest minimum.
That reminds me, talking about health, since 2015, Governor Okowa don continue to ensure say the health system for Delta State dey very strong enough to withstand any kind of outbreak and infectious disease.
You know, say Governor Okowa don accelerate efforts to end HIV pandemic. He don plan and implement HIV prevention, treatment and sensitization programs. That reminds me, you don't even check your HIV status.
I dey fear.
I no fear. Better say you know. After all, when you dey commit the sin, you no fear.
Governor Okowa is still working and transforming Delta State.
Smart Delta. As part of the desire to deepen the fight, a bill prohibiting all forms of discrimination and giving protection, access to justice, support and care for all persons living with and affected with HIV and AIDS in Delta State has been passed by the Delta State House of Assembly.
Those against the name, the ayes have it.
Is an anti-discriminatory bill against people with HIV/AIDS. The essence of the bill is to make provision for laws to ensure that people who are living with HIV/AIDS are not discriminated. There's no segregation, stigmatization, and give them that allowance to live as ordinary citizens without any form of stigmatization.
Very recently, Delta State hosted a 3-day workshop in the state's city capital, organized by the National Agency for the Control of AIDS, NACA, South-South Zonal Office, aimed at building the capacity of the media, stakeholders and partners on the implementation strategy.
The NACA South-South Zone and of course the different state SACA as well as the development partners have done so well both in the past and at the present. Every government media organ in our state takes every message that has to do with HIV/AIDS free. That's to tell you the importance attached to this particular subject matter. We are pleased that this training has been brought to our state. That means that the number of persons will become much more knowledgeable, and that knowledge to a very large extent will also help us to reduce the incidences of infection, even as it will encourage those who are hiding and not likely to present themselves for test to come out, knowing that the issue of stigmatization doesn't mean anything anymore.
The current outbreak of polio in Malaysia propelled the state government, in collaboration with the federal government through the Delta State Primary Healthcare Development Agency, to kick off a vaccination program for 4 days and an extra 2 days mop-up. Smart Delta team was on ground to capture the process.
We call this particular campaign OBR. It's an outbreak response because we have our neighboring states where they found poliomyelitis. So that's why the government made it possible that this particular exercise should be conducted again this year. So these teams, they are made to move around from house to house to see that no child is missed.
This immunization, it helps to curb a lot of diseases, especially this a vaccine will take against polio, against measles, yellow fever, and etc. I'm impressed. The Delta State government, they are wonderful, especially our governor, actor Ifeanyi Okowa.
From house to house, the immunization team walked through communities to administer OPVs to all children between the ages of 0 to 5 years across the 25 local government areas, and also deep down into the riverine areas.
We are to educate them about the poliomyelitis, that is a disease that causes paralysis of the leg and the hand, which will make the child to become a cripple or will be leaping when walking. The mothers, they were happy because it saved them the stress of going to the health center themselves, since it's a rural area. I believe that with this exercise, polio will be kicked at from the entire Delta State, including Nigeria.
Then come my house, come give the children. So they think Okowa we give na the work. Maybe na they come house to house, knock both upstairs, downstairs, knock for our door, and I come give the children the medicine. Without us now custom me, say make I do and say you go good. I'm not sure I go feel give my picking because even me, I dey fear.
It is also worthy of mention that these children from 0 to 5 years who are registered under the equity plan of the Contributory Health Insurance Scheme and elderly above 65 years of age have access to health care services free of charge in Delta State.
The scheme is very okay. The services, especially the under 5, was superb. The doctors were friendly to the children. At the time, my daughter said, "Mommy, let's stay here." And I said, "No, this is a hospital, it's not our home, we have to go back." In terms of antenatal, I really want to give them kudos. Sometimes I think about the financial aspect. If I were to go to a private hospital for each antenatal checkup, I know how much I would spend on it. But here we come, we spend nothing, and we still get the medical care.
The formal and informal plans of the contributory healthcare system for individuals who are not captured in the equity plan is also taken care of with a premium of $7,000 annually. An essential prerequisite for achieving universal health coverage (UHC), where all Deltans can obtain quality health services without suffering financial hardship and keep safe from any virus infection.
Based on the universal health coverage, the state has tremendously achieved a good number of input from health workers and even the beneficiaries. The volume of beneficiaries has increased tremendously. So people can now access health care without financial constraints.
The state government also rolled up its sleeves to tackle the outbreak of yellow fever, which occurred in 2020. With subsequent training and vaccinations, the infectious diseases were controlled and managed to the barest minimum. No doubt, undertaking several steps in readiness to deal with these diseases at subsequent times has largely helped the state tackle COVID-19 pandemic when it surfaced, and now it is almost a thing of the past.
What the Delta State Primary Healthcare Development Agency did in collaboration with the Ministry of Health and also with all the funding from His Excellency Senator Dr. Ifeanyi Okowa, we were able to curtail the COVID spread. And that means we use the structure that we normally use to run the Primary Healthcare Development Agency.
Now let's talk about malaria, which continues to take a high toll on households and affects both the rich and poor.
By data, Nigeria before occupied 25% of malaria in the world. So we're trying to see how we can reduce it. Thank God His Excellency, the Executive Governor of the state, has signed the counterpart funding, which is going to make the journey very smooth in Delta State.
We have different interventions and strategies of malaria control, the use of the insecticide-treated nets, which is the ITN. Once we distribute the nets, as it is planned, every household will have at least 4 to 5 nets.
In addition to these investments, the Delta State's first mother and child specialist diagnostic hospital, Owalero, stands tall and almost ready to use. This alludes to the fact that Governor Ifeanyi Okowa's uncommon passion and commitment to the healthcare system in the state is unique.
We are at the stage of completion. You can see that the quality of work is good. It's a good sight to behold. The construction work is something that you appreciate, and even the environment itself is very welcoming.
The key factors of these successes recorded in Governor Okowa's administration are embedded in the state government's level of support and preparedness, strong health infrastructure, rigorous and comprehensive contact tracing, and follow-up at the grassroots level, thereby achieving a healthier and stronger population for all indigenes and non-indigenes of Delta State.
The feedback segment.
This week we have a commendation on our Instagram page from Tracy Oreva, and it reads, I want to specially thank His Excellency Senator Arthur Ifeanyi Okowa for his deep involvement in the healthcare sector, especially with our brothers and sisters living with HIV and AIDS. May God continue to keep you as you walk towards finishing strong.
I want to urge all Deltans and all Nigerians and persons from across the world to continue to watch Smart Delta. They're doing so well. It's a good means of communication of what we do in Delta State. I'm quite excited that they've been getting the information out there. If you want to know a lot about what is going on in governance and development in Delta State, continue to watch Smart Delta. You will definitely be able to get all the information that you require.
Text your questions to 081-211-92133 or send with the hashtag AXIT to all our social media platforms.
You better run, come to Delta State. Come and see the good things where Okowa they do. You better run, come to Delta State. Come and see the good things where Okowa they do. I see your job and work creation in Delta. Make the youth say them highlight Okowa. I see good roads everywhere in Delta. Make the people say them cola. Come live in Delta. Say me I say, come invest in Delta. Come explore the potentials of our state.